Hi, you're my next patient? Here for the cranial nerve exam? Okay, but just sit down please, make yourself comfortable. I'll be with you in just a second. Now, because you have never been here, first I want to ask you some questions to get to know you and your medical history. Okay, would you please tell me your full name? Is that spelled with a C or a K? Got it. Do you want to share your preferred pronouns with me? Okay. Can you give me your date of birth, please? Good. And a phone number that I could reach you under if it were at all necessary. 28. Okay. Do you have any allergies that I should be made aware of? Okay. No, that's not going to be an issue. No, mainly I just ask because of the taste or smell test that we are going to do. And then of course I am going to wear gloves. So I always ask about latex allergy because I do have latex or non-latex gloves, so I would make that up to the patient. Okay. Now, you said on the phone when you made the appointment that you had a light hit to the head. Okay, yeah, I understand. Has that caused any nausea, headache, or dizziness at all? Some headaches? Yes. But you did not feel dizzy at all? Okay. Have you had any flu-like symptoms within the last 14 days? Okay, good. Do you take any medication regularly, like on a daily basis? Okay. Your temperature and your blood pressure was checked outside by the nurse, correct? Good. And that data should be up within the next minutes. Okay. I am going to wear gloves, but do you feel comfortable with me touching you at all during this examination? Okay, very good. At the start of the examination, I want to give you 4 words that I want you to remember, and then at the end of the exam, I'm going to ask you about these 4 words again, okay? You can say them after me however you think you can remember them best. So the first one is going to be starship, apple, race car, and then glasses. That's one thing to remember that by. Okay, first I'm going to get a little bit closer to you and really have a look at your face, okay? I'm also going to check your head because of the hit that you had, okay? Okay. Could you maybe show me where you hit your head exactly? Yes, okay. No, that seems just fine. I don't really see any redness there or anything that really makes me think that you really hit anything important at all. Okay. Your ears look fine, but I'm going to get back to them in a second. Okay. I'm going to have a close look at your eyes, but I seem to have misplaced my light, but do not worry. I do have a bit of a bigger one, so it might get a bit bright, but just for a second, okay? Yes. Okay, Your eyes are a bit red. Do you know at all why that is? Really? Okay. Know that. I'm not judging that. That's fine. Do you do that regularly? Okay. Yeah, no, that's not something you should have said, but I am going to note it down, okay? Do you, have you talked about this with the doctor at all? Okay. No, if he's fine with that and he's checking on that, that's definitely okay. Do you consume other drugs regularly? No? Okay, good. That's it for the eyes though. Apart from that, your eyes look pretty fine to me, but we are going to continue with another eye exam. So first of all, I have these color pens here, and all I want you to do is to tell me what color the pen is. So what color is this? Okay, perfect. What about this one? Okay, yes, same as my glove. What color is this pen? Red, perfect. And what color is this pen? Green, good. What about this color? Yes, that's purple. And a last one, what color is this? Gray, very good. Now, just because I always think about that, if you were to write grey, would you write it with an A or with an E? Interesting. No, because I do have a lot to do with writing, and I seem to never know. Yes, even as a doctor, you can make those kinds of mistakes. That's fine. Okay. Now, before we continue, out of these colors, which one do you like best? Cool, okay. Now for me it will be the yellow one, so that's the one I'm going to keep here now. Okay, what I want you to do is to really focus on the pen, okay? I'm going to move it and I want you to follow it with your eyes exactly. Let's see if that works. Look at the pen and follow it with your eye. Good job. Yes, now I'm looking at your eye movement. Good. Okay. Now that seems to be fine. Okay, next I'm going to check your peripheral vision. For that, I'm just going to use my fingers. I'm going to move them away from your face, and I want you to tell me when you don't see them anymore, okay? Can you see my fingers? Good. Okay. Yes. Okay. Good. Now I'm going to hold them away. I'm going to slowly move them inwards. You tell me when you start seeing them. Yeah. That was very asynchronous for me, I'm sorry. Last time. Good. Okay, next I'm going to do a smell test with you. First it will be this. Peppermint, very good. What does that smell like? Roses. Yes, it does. Very nice, isn't it? Just have one more. Yes, guess it just looks just the same. It's not the same, is it? This is lavender, very good. It does smell a lot like peppermint now, does it? But I think that's quite nice, isn't it? Okay, next up we are also going to do a taste test. So I also have a few liquids, and I'm just going to put a drop of this on your tongue. So I want you to stick out your tongue for me, and then just tell me what it tastes like. What does that taste like? Peanut butter. Correct. I do have another one. Strawberry, correct. And we're also going to do 3 here. You might be able to tell just from the colour, but I'm still going to take it. Oops. I almost spilled on my floor there. It's lemon, correct. Okay, so I'm not at all worried about your taste or smell. That is very good. Before I said that, I'm going to have another look at your ears, specifically whether you hear something or not. So what I'm going to do is I'm going to make a sound close to your ear, and then you tell me whether you hear it, and then also on which ear, okay? So I want you to close your eyes now. Very good. I'm only going to do the sound on one ear. Yes. Very good. Right side again, yes. Yes, that was both sides. Now I have this little wooden skewer maybe here. It's not really sharp, but you can definitely feel it when it touches your skin. So what I want to do is I want you to close your eyes again, and I'm going to kind of scratch your skin with it, and you're going to tell me where on your face it's touched your skin, okay? Good. Close your eyes, please. Okay. Yes. Very good. Okay. Okay. Yes. Next up, we're going to do a sharp or dull test. For that, I have this brush here, which of course has a very dull, brushy side. And then this, it's not really sharp, but you can definitely feel the difference. Close your eyes again, please, and then I'm going to touch you either with the dull or with the sharp side, and you're going to tell me whether it was the dull or the sharp side. Sharp side. Dull side. Sharp. Sharp. Dull. 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 Perfect. That seems just fine. Now I'm going to check out your motor functions concerning your face. So first I want you to smile for me. Big smile. Good. Perfect. Now I want you to raise your eyebrows, so go like this. Okay. And then frown for me, like really angry. Perfect. Okay, so that's good. Now stick out your tongue, please. And then move it from the left to the right side. Okay, yes, that's just fine. Now I want you to really lock your jaw, okay? And I'm going to try and open it. Okay, so really hold it close, right? Don't open your mouth. Okay, now you open your mouth and I'm gonna try and close it. Don't let me close it. Okay, perfect. I'm going to hold my hands on your shoulders and I want you to shrug even though I hold it down. Okay, we're gonna do the other way around. You really lift up your shoulders for me. I'm going to try to push them down. Okay. Yes, that seems just fine. Now close your eyes for me. I'm going to try and open them. Don't let me open them. Okay, perfect. And now really lock your head in place. I'm going to try and move your head from left to right. Don't let me move your head at all. Okay? Yep. Good. Now, we are at the end of our examination. Do you remember the 4 words that I asked you to remember at the start? Starship. Apple, very good. Race car, and the last one. Glasses, very good. No, I'm gonna give you that, that's just fine. So, since you have complained about a headache, I don't really see a reason why you would have any serious injury. But because of your headache, I am going to give you a few pain meds. You're allowed to take these every 8 hours. And your headache should be gone within the next 2 days. And if it is not, please just come back and then we are going to figure that out, okay? But for now, I don't really see a reason why it should last any more than 2 days. Okay, so I'm going to give you these. And that's really everything. Thank you for being here. Thank you for holding out the examination. I hope it wasn't uncomfortable for you at all and that you maybe recommend our clinic and come back for another visit. Yes. Thank you. Have a nice day.